What if Meredith Grey worked at the Pitt? Imagine this for a moment. One of television's most experienced surgeons walks into a hospital that thrives on chaos, speed, and relentless emergency medicine. That surgeon is Meredith Grey. For years, Meredith has been at the center of the medical drama Grey's Anatomy, navigating groundbreaking surgeries, personal trauma, and hospital politics. Now imagine her stepping into the brutal, fast-paced world of the Pitt. The Pitt is not Seattle Grace. It's not Grey Sloan Memorial. It's raw, it's urgent, and it forces doctors to make life-or-death decisions in seconds. So what would actually happen if Meredith Grey suddenly became part of that world? Today we explore a fictional crossover scenario, how Meredith would fit into the Pitt, how she would interact with its doctors, and what the first few episodes might look like. Part 1. Meredith Grey's reputation. By the time Meredith arrives at the Pitt, she would already be one of the most respected surgeons in the country. She has survived plane crashes, hospital shootings, pandemics, and countless personal losses. Her reputation would arrive before she even walks through the hospital doors. Doctors at the Pitt would immediately recognize her name. Some would admire her. Others might question whether someone used to the prestige of a surgical center could survive the chaos of emergency medicine. Part 2. The culture shock. The first thing Meredith would notice is how different the culture is. At Grey Sloan Memorial, there is time for complex surgical planning. At the Pitt, everything moves faster. Patients arrive constantly. Trauma cases pile up. Doctors must make decisions in seconds. Meredith would realize quickly that while she is an exceptional surgeon, this environment demands a completely different rhythm. But Meredith has learned to adapt. Years of pressure have prepared her for this kind of challenge. Part 3. Meeting Dr. Robbie. One of the most interesting dynamics would be Meredith interacting with Dr. Robbie. Robbie thrives in emergency medicine and is comfortable making rapid decisions. Meredith tends to analyze and consider multiple possibilities. Their early interactions would likely be tense. Robbie might question Meredith's ability to adjust to emergency medicine. Meredith might challenge Robbie's instinct-driven approach, but over time mutual respect would develop. Both doctors would recognize that the other possesses skills they themselves do not. Part 4. Meredith's surgical skill. Meredith's greatest strength remains surgery. Even in an emergency environment, complex trauma cases still require surgical expertise. Meredith would quickly prove her value. She might introduce new surgical approaches for trauma patients. She might mentor younger doctors, and she might push the hospital to innovate in ways it never expected. Part 5. The emotional side. Emergency medicine exposes doctors to constant tragedy. Patients arrive with devastating injuries. Families face heartbreaking decisions. Doctors must learn to compartmentalize emotion just to survive the job. Meredith understands grief better than most. She has lost friends, family members, and mentors. Because of that experience, younger doctors might turn to her not just for surgical advice, but for guidance on how to cope with emotional trauma. Part 6. Hospital politics. Where there are doctors, there is politics. Meredith's arrival would disrupt the hospital hierarchy. Some doctors would see her as a mentor. Others might see her as competition. Hospital administrators might push her into leadership roles. And Meredith has never been comfortable with authority structures that interfere with patient care. Conflict would be inevitable. Part 7. Episode 1. Arrival. In the first crossover episode, Meredith arrives as a visiting trauma consultant. Her arrival coincides with a massive emergency event. Multiple trauma patients flood the hospital. The emergency department becomes overwhelmed. Meredith jumps into action immediately. By the end of the episode, the staff realizes she is not just a famous surgeon. She is someone who thrives under pressure. Part 8, Episode 2. Proving herself. In the second episode, some doctors remain skeptical. They assume Meredith belongs in an operating room, not a chaotic emergency department. But when a complicated trauma case requires both surgical expertise and rapid decision-making, Meredith proves she can handle both. The case becomes a turning point for the staff. Respect begins to grow. Part 9, Episode 3. Stay or leave. As Meredith spends more time at the Pitt, a new question emerges. Should she stay? Some doctors want her to remain permanently. Others worry her presence might change the hospital culture. Meredith herself begins to wonder whether this chaotic hospital might be exactly the challenge she needs. Part 10. Why the crossover works. Grey's Anatomy focuses on long-term relationships and surgical innovation. The Pitt focuses on emergency crisis and survival medicine. Combining those worlds would create powerful storytelling. Meredith would be forced to adapt, and viewers would watch a familiar character grow in an entirely new environment. Meredith Grey has survived almost everything a medical drama could throw at her. Loss, chaos, unimaginable pressure. So, if she walked into the Pitt, she wouldn't arrive as a newcomer. She would arrive as a survivor, and in a hospital built on chaos and resilience, that might be exactly the kind of doctor they need.